Hey, my name is Jade, otherwise known as Backline Nurse, and today I'm going to talk to you about one of public health's most notorious villains, Typhoid Mary. Typhoid Mary has been portrayed as a villain in history, science, popular culture ever since the early 1900s. But was she really the villain of her story? Well, let's figure it out. But first, what is typhoid fever? So typhoid fever is caused by the bacteria Salmonella typhi. The illness today is rare in developed countries, but still poses a threat in developing countries. So this bacteria is transmitted usually by the fecal-oral route. It can be transmitted via contaminated food or water or direct personal contact with an infected person. Signs and symptoms include high fever, stomach pain, diarrhea, constipation. Without treatment, the illness will progress to later stages that can include delirium and something known as the typhoid state, which is described as lying motionless with your eyes half closed. So this is most readily transmitted by somebody having the bacteria on their hands, probably after they use the restroom, not washing their hands, and then preparing food, and then another person consuming that food, or waste infiltrating a water system. Typhoid Mary, as she's known to most of the world, was born Mary Mallon in Northern Ireland in 1869. She came to the United States to work as a cook in 1884. So the thing that's really important to understand about Mary Mallon is that she had no idea she was a carrier of this typhoid bacteria because she never displayed any symptoms. It's believed that Mary contracted typhoid before she was even born because her mother contracted it during pregnancy. The concept of asymptomatic carriers was a brand new concept that was not known really before her, even to science. It was fairly common at this time to not wash your hands after you use the restroom every time, and we'll get more into why later. So it was fairly easy for intestinal bacteria or fecal bacteria to get on your hands and then subsequently into the food you're making. But cooking that food would heat it up to temperatures that would easily kill that bacteria. But Mary had a signature dish that all of her clients were most fond of, and it was peach ice cream, which sounds delicious until we get into the next part. This ice cream involved raw cut up peaches, cut up by Mary herself, and of course they weren't cooked before they were served. So this is a prime vehicle for a bacteria to get from Mary's hands into the mouths of susceptible people. Okay, so back to the timeline. In September of 1900, Mary obtained a job working as a cook in Mamaroneck, New York. So this was a summer house, so obviously this family was pretty well-to-do. Shortly after Mary began working there, there was a typhoid outbreak among the family. Mary didn't become sick, so she wasn't suspected of transmitting it. They believed it was one of the family's sons who had recently visited an army base in Montauk, New York, where typhoid fever was pretty endemic. Then in 1902, Mary obtained a new job with another rich New York family at a house in Dark Harbor, Maine, which, by the way, was like the most goth name of a town I've ever heard, so I looked it up, and the town looks like it's straight out of The Ring. 7 days. So this house had again been rented as a summer home by a wealthy New York family. The father of the family was a lawyer named Coleman Drayton. An outbreak of typhoid fever occurred 2 weeks after Mary's arrival, and 7 out of the 9 people in the house became ill. Mr. Drayton was not one of them. It was believed he was likely immune from a previous exposure, and it was believed that somebody in the family, one of the people that had fallen ill, contracted it outside of the home and brought it back with them. So Mary and Mr. Drayton were the only 2 that weren't sick, and so Mary worked alongside Mr. Drayton to take care of his family while they were ill. Mr. Drayton, being a man that was probably not used to having to take care of his family in such a way, was very grateful to Mary for her help and even gave her a $50 bonus on top of her actual salary. Now, $50 in 1902 would equal about $1,500 today. So pretty sweet bonus. So these outbreaks did eventually draw attention, not because it was strange that the disease was there in New York, but because of who it was affecting. Typhoid fever was believed to be a disease of the poor. It would occur somewhat regularly in poverty-stricken populations, places with overcrowded living conditions, unsanitary living conditions. It was thought to be a disease of the third world. So usually outbreaks were just kind of dismissed. But since these outbreaks were occurring in the summer homes of white, wealthy affluent New York families, it drew some attention and eventually warranted an investigation. The investigation was launched in 1906 when a disease investigator named George Soper, who seemed to be like kind of an epidemiologist that wasn't really employed by any public health agency, it kind of seemed like he was like working for himself. He was hired because of an outbreak that occurred in 1906 in August at, you guessed it, the summer home of a wealthy New York banker. His name was Charles Henry Warren, and from August 27th to September 3rd of 1906, 6 of the 11 people in the house there came down with typhoid fever. At this time, typhoid fever was fatal in about 10% of cases. So after this outbreak, the landlord of the home rightly figured that nobody else would ever want to rent it because they believed that typhoid came from water and unsanitary living conditions. And so he hired George Soper as like an independent investigator to figure out where the pathogen had come from. They checked the pipes, toilets, faucets, everything, and couldn't find any presence of the bacteria in any of those things. After doing a little bit of investigating about who was in the home when this happened, George Soper became interested in the cook, who was, you guessed it, Mary Mallon. She had vanished shortly after this outbreak. So Soper found out her general physical description and the agency that she worked for. By this time, she had already acquired a new job at the home of Walter Bowen, who lived with his family on Park Avenue in New York City. That's where the rich people live. She worked for this family through the end of 1906 and into the beginning of 1907. And on January 23rd, 1907, the maid in this family got sick. And due to this outbreak, Charles Warren's only daughter died. So George Soper was already hot on the trail of Mary Mallon when he heard news of this outbreak. And after talking with Charles Warren, he found out that Mary was in fact the cook in the home. So he took it upon himself to confront Mary to try to put a stop to her spread of this disease. Before I tell you about this ridiculous confrontation between Mary and George Soper, I want to give you a little bit more context. There is no way that at this point Mary knew that she was the one causing this disease. We know this because the idea of asymptomatic carriers of typhoid fever, and I think of most diseases in general, had not even been proposed within the scientific community. It was 1879, not even 30 years before this, that the bacteria that causes typhoid fever was discovered and isolated. And it was the widely accepted belief every single case was caused directly by somebody else who had been ill and had symptoms. And again, also at this time, washing your hands frequently was not common because germ theory was not fully accepted, even within the scientific community. So of course it's not something that's even considered by a cook or any normal person that doesn't have to know about things like that. I know I've talked about this in other videos, but germ theory is the general belief that illness is caused by microorganisms, pathogens invading the body. We now know that this is absolute fact. However, it was pretty novel science at the time. Prior to germ theory, the most widely accepted theory was something called miasma theory. Miasma theory was the belief that illness was caused by poisonous vapors made up of particles from decomposing material and could be identified by foul smells. So essentially, things that smelled bad could cause illness. The lack of hand washing at this time was so common, in fact, that the pioneer of hand washing in hospitals, a man who saved countless lives, Ignaz Semmelweis, his research was so vehemently opposed within the medical and scientific communities that he was driven mad. He was essentially gaslighted by these scientific professionals because he was challenging such a firmly held belief that had been in place for centuries at this point. Okay, so now we're back to Mary and George Soper. They're about to have their first confrontation. So George Soper went to Charles Warren's home and confronted Mary in the kitchen, her domain, her territory, you know? So George goes in and demands samples of Mary's blood, feces, and urine. You want to take a guess at how that went for him? Put yourself in Mary's shoes for 1 second. You're a cook and you've just seen multiple families that you've worked for become ill. You don't believe that there is any fathomable way that you are the one causing this illness. And suddenly a man you've never met before appears in your kitchen accusing you of causing those outbreaks, which by the way at this point have caused at least 1 death, and demanding your blood, pee, and poop. George Soper himself described this interaction in one of his subsequent publications. I'm going to read it word for word because he describes it much better than I ever could. It did not take Mary long to react to this suggestion. She seized a carving fork and advanced in my direction. I passed rapidly down the long, narrow hallway, through the tall iron gate, out through the area and to the sidewalk. I felt rather lucky to escape. I confessed to myself that I had made a bad start. This is why nuance and communication is so important in public health. Something that's really interesting to me is Soper's description of Mary's appearance. Quote, "She was 5 feet 6 inches tall, a blonde with clear blue eyes, a healthy color, and somewhat determined mouth and jaw. Mary had a good figure and might have been called athletic, had she not been a little too heavy." Rude? After this interaction, Soper decided to compile a history of Mary's employment between 1900 and 1907. He found out that Mary had worked in the homes of 8 different affluent New York families, and 7 of those had fallen ill with typhoid fever. Nobody had caught on to the fact that Mary was causing these outbreaks because she usually left fairly quickly afterward, and also she never became sick. After compiling this history, Soper found out where Mary's boyfriend lived and decided to go confront her again. This time he brought reinforcements. He brought Dr. Raymond Hubler, and the two of them were going to try to convince her to give them samples of her blood, urine, and feces. "Hi, how you doing? Can I have your poop?" In Soper's account of this visit to this home, his disdain for Mary and I think the working class that she represented is obvious. He says he found Mary living at a rooming house with a disreputable looking man who lived in a room on the top floor. He describes this room as a place of dirt and disorder and notes, "I should not care to see another like it." He then goes so far to note that, quote, "It was not improved by the presence of a large dog, of which Mary was said to be quite fond." You don't like dogs? It's another strike for Team George. Mary again refused to give samples because she believed that typhoid was everywhere and that outbreaks occurred because of contaminated water, which was the most widely held belief at the time. So after once again failing to help Mary understand the urgency of the situation, Soper decided to go to the New York Public Health Department, which so far he's just like, he's not even working for the government or a public health agency. He's just like a dude that just decided to do this because he was hired by a rich family. He's just like stalking this woman and asking for samples of her blood and stuff. Like, what the if anyone knows more about George Soper and wants to tell me I'm wrong about that, please let me know. But like, it really seems like dude was out of line. That's how I feel. So after Soper told the New York State Health Department about Mary and his theory that she was the one causing these outbreaks, Mary Mallon was arrested as a public health threat. Upon her arrest, she was forced into an ambulance by 5 male police officers and a doctor who said later that she had to sit on Mary to restrain her. Mary was then taken to Willard Parker Hospital. For 4 days after Mary was arrested, she was restrained to a bed. She was not allowed to get up and even go to the bathroom on her own, and she was forced to give the samples of blood, urine, and feces. On March 19th, 1907, Mary was sentenced to quarantine on North Brother Island, where she would be required to give stool and urine samples 3 times per week. After her arrest, Soper was quite proud of himself, and he published an article in the Journal of the American Medical Association, which attracted a ton of media attention, and because of this media attention, Mary then was known to the public as Typhoid Mary. Later, even the textbook that defined typhoid fever would refer to her in it as Typhoid Mary. Okay. Mary despised her new nickname and the fact that she was being blamed in the media for spreading these outbreaks as if she knew that she was doing it this whole time. She said that she was being treated as a guinea pig and was forced to give samples 3 times a week, but she wasn't allowed to see an eye doctor for 6 months, even though she had a condition in her eye that was causing her eyelid to be paralyzed and she had to tape it shut at night. While she was hospitalized, she was forced to take courses of medication in 3-month blocks for an entire year. This medication threatened to destroy her kidneys. Keep in mind that even though this bacteria had been identified, there were no antibiotics to treat it yet. Mary was first told by her doctors that the infection was in her intestinal tract, and then her bowel muscles, and then her gallbladder. Authorities attempted to demand that she have her gallbladder surgically removed. However, she refused because number 1, she still didn't believe that she carried the disease. And number 2, gallbladder removal surgery was extremely dangerous at the time, and people died during this operation quite regularly. Now, fortunately, there were some progressive medical experts that disagreed with forcibly quarantining Mary Mallon. So after almost 3 years in quarantine, it was decided by the New York State Commissioner of Health that Mary could no longer be forcibly kept in isolation and that she could be freed as long as she agreed to never work as a cook again. Mary agreed and was released. So here's what's really important to note about that. The New York State Commissioner of Health ordered that Mary never return to the only profession she had ever done. She had no other skills really, and being a cook paid relatively well, and they gave her no financial assistance to make up for this loss in income. After Mary was released, she was given a job as a laundress, which paid $20 per month instead of the $50 per month she made as a cook. So Mary was now making like a third of her former salary, and she hit another hardship when she got a cut on her arm that became infected, which prevented her from working for 6 months. After several years of poverty and no assistance from the government, Mary made the decision to begin cooking professionally again. So Mary was blacklisted by any agencies that hired private cooks for families. So she decided to go to the mass sector to work in restaurants and other larger kitchens. As you can imagine, outbreaks of typhoid followed her where she went, but she would leave immediately after they started. Eventually, in 1915, she was busted when she was trying to bring food to a friend in Long Island. And she was arrested again and sentenced to quarantine for the rest of her life on North Brother Island. Mary lived there for 23 years until she died of pneumonia in 1968. The most baffling part of this to me was by the time Mary died, New York public health officials had identified over 400 additional asymptomatic carriers of the bacteria that causes typhoid fever. And yet not one of them was forcibly quarantined. After all was said and done, Mary is believed to have infected a total of 53 people and caused 3 deaths. Today, Mary Mallon's legacy is the villainous Typhoid Mary, which has become a colloquialism for anyone who is spreading an undesirable thing. Mary was the first case of an asymptomatic carrier being discovered, meaning she contributed to the advancement of public health greatly, but she was treated like a criminal and forcibly isolated for almost her entire life. The ethics of what happened to Mary Mallon are still discussed today. I mean, obviously. So why was Mary vilified? Like, super vilified? The reasons for this, I think, are twofold. Mary didn't conform to the picture of femininity for her time. She was an Irish immigrant, and Irish immigrants were already discriminated against in New York City at this time. She was poor. She was willful and said to have a hot temper. She allegedly had multiple sexual partners but remained single. Those who knew her best in the long years of her custody said that Mary walked more like a man than a woman, and that her mind had a distinctly masculine character as well. Your mind looks like a boy. The second reason for why I think Mary was vilified so much is where it becomes really relevant to what we're dealing with today. When something goes wrong, harms other people, disrupts our lives, we as humans naturally want something to blame, or better yet, someone to blame. We want to be able to point our finger and say, that thing is the reason I'm suffering. This has been obvious during the COVID-19 pandemic and pandemics and epidemics throughout history. But with something that you can't even see, like a virus, it's really hard to pin down that thing that you can blame. We always want to know, who was patient 0? Who ate the bat in China that gave us this disease? It's their fault for being disgusting and eating a bat. This attitude is not only unhelpful, but it's rooted in racism, classism, xenophobia, or all 3. And by the way, patient 0 for COVID-19 has not been identified. So in fact, blaming a single person for the spread of a disease is wholly counterproductive to public health efforts. It is, more than anything else, and especially in the case of Typhoid Mary, a way for government officials to avoid accountability for insufficient action or failed interventions. And it's a way for us as citizens to justify our individual decisions to not follow precautions that could stop the spread of a disease, because it allows us to dismiss a disease as something that only affects a certain type of people, and that us civilized folks don't need to worry about such things. The fact is that we can't avoid pandemics and epidemics. They've been happening throughout history, and they will continue to happen because pathogens evolve. However, much like other uncontrollable events, tornadoes, floods. They can't be completely prevented, but they can be prepared for. I think public health and government officials failed Mary Mallon and subsequently failed other victims of typhoid fever. They treated her like a criminal and immediately destroyed any potential trust or rapport that could develop. They gave her draconian orders to not return to her career, the only job she's ever known. And they did so without offering a single safety net to make sure that she would not have to make the difficult decision to starve or risk infecting other people. They didn't offer her compensation to make up for her lost income, even though she was vital to the scientific understanding not only just of typhoid fever, but of the concept of asymptomatic carriers as a whole. Mary Mallon is and was vital to public health, but all they did was treat her like a scapegoat. Ordering citizens to comply with public health regulations that disrupt their lives without providing them a safety net to do so is ineffective. Full stop. And this is happening today. We're being told to stay home and not go out in public because that has been proven to be the most effective way to stop the spread of this virus. And that's absolutely what we should be doing. But in the US, there's not a nationwide policy to enforce a shutdown, which shirks the responsibility off of the federal government down to the state governments, who then have to decide between saving their economy and doing what's best for the interests of public health. And even those that do make the right choice aren't able to give their citizens that financial safety net to get them through the period when they're not able to go to work because the federal government is like, whatever. I mean, they gave us a one-time stimulus, but that was not enough to even cover 1 month of rent for most Americans. So those whose jobs cannot be moved to a home office are left without income. And in the states where it's business as usual, in spite of case counts and death counts rising every single day, workers are forced to make an impossible decision to either keep themselves and others safe from a deadly virus and not have money to feed themselves, or continue making the money they need to survive and risk getting sick or spreading the virus to other people and their loved ones. This is an impossible choice. And it's the same choice that Mary Mallon was faced with. And as was the case with Mary Mallon, and the case today with COVID-19, and the case with pretty much every public health disaster in history, those in a society who are already marginalized suffer the most severe consequences. So as we move forward, I want you all to look at the regulations being imposed critically. And even if they sound promising to you, ask yourself some questions. How is this going to affect people with less money than me? How is this going to affect people who don't have insurance or sick leave? How is this going to affect people who are a different race than me or have a disability? Are they giving everyone the resources they need to comply with these regulations? And if not, don't stay quiet about it. Demand more. In the story of Mary Mallon, nothing was done about typhoid fever, which was a disease that was present and not that uncommon in the United States and killing 10% of the people it infected. Nothing was done about it until rich white families were affected. If you, like myself, fit into what's considered the privileged class in your country, you need to be using that privilege to drive change. A virus doesn't care who you are. A bacteria doesn't care what's in your bank account. A pandemic doesn't stop killing people just because it stopped affecting people you know. Rest assured, if we're not trying to stop this spread of this virus in every single community, it will come back over and over again. Sorry to end on such a bummer note, geez. But that's the end of my video. Thank you for watching. Please like and subscribe, hit that notification bell, leave me a comment, let me know what you want to hear about. Check me out on social media. I just made a Facebook page. I'll be posting stuff from all different platforms there. But anyway, that's all. Please don't give up. Please don't lose faith. We're almost there. Wherever you are in the world, be safe and be kind. Until next time.